Well, welcome everybody to today's Doctors In program. Great to have you all here with us this afternoon. My name is David Griffith. I'm the Director of Programs and Outreach for the Elder Initiative at the William Way Community Center. Happy to welcome you here to today's Doctors In on sleep and fatigue. So for folks who have been with us for Doctors In the past, this is a partnership between us at the Elder Initiative and the Jefferson Department of Family and Community Medicine, which houses their division of geriatrics and their division of palliative care. And so we do these programs, having Jefferson doctors come in each month to present, share their expertise, and answer your questions about pressing health concerns. In this program today on sleep and fatigue, this is a brand new topic for us. That actually came up because a number of people suggested it when we did our last round of surveys, trying to get feedback on what topics to address. So we're excited to be able to cover that for you here. Today. I haven't finished my coffee yet. I'm sorry. Couple housekeeping things before we get started, which folks who have been on Zoom with us will know, but just as a reminder, there are two ways for you to engage with the program here today. You can put things in the chat as we go. Do know that when you use the chat, your name does appear with your question or comment. You can also use the Q&A feature. Both of these are in the toolbar at the bottom of your screen. When using the Q&A, there is an option to ask your question anonymously. So if you are sharing anything more personal that you don't want your name attached to, use the Q&A and click to ask your question anonymously. I'll be keeping an eye on the chat and Q&A. I know we are going to have a lot of time for questions at the end, so we may hold some of those questions, but do know that I'll be keeping an eye on those and relaying them to the presenter. Our presenter is Dr. Dan Boron Brenner. He is a palliative care fellow at Jefferson. He is making his Doctors In debut with us today, so we're very happy to have him here with us. And so I'm going to turn it over to you, Dan, to get us started with the presentation. And thanks again for being here.
Thank you for having me. It's a real pleasure to be here speaking to everybody. Thank you for the introduction. Very quickly about myself, I'm one of the palliative care fellows at Jefferson. I have a background in emergency medicine, but sleep and fatigue interacts with and is influenced by all domains of medicine. So this is something that's really relevant to our practice and to people's day-to-day lives. So I have no declarations to declare. Just a general overview of the talk. We're going to be discussing fatigue first, and kind of what is fatigue, how you are affected by it, and how your doctor will evaluate you for it. And then what is sleep and how we experience it, and then how we can hopefully get better night's sleep if we are experiencing something like insomnia. So the medical definition of fatigue. It's a difficulty or inability to initiate activity, a subjective sense of weakness, a reduced ability to maintain activities once started, or even difficulty with concentration, memory, or emotional stability. It is commonly experienced and encompasses many other symptoms in addition to this. Many of them are what doctors call non-specific. So there's no one symptom that by itself says you have fatigue. And it is not to be confused with a need for sleep or excessive sleepiness. There are different types of fatigue, and doctors typically categorize them based on how long you've been experiencing the constellation of symptoms that we call fatigue in medicine. Acute fatigue is 1 month or less. What we call subacute fatigue is typically greater than 1 month, but less than 6 months. And then chronic fatigue, which can exist without having a diagnosis of chronic fatigue syndrome, which I will discuss later on, is typically 6 months or more. Up to 33% of people seeking out primary care visits report fatigue as what's considered to be an important complaint for them. And nearly 7 million office visits a year involve a complaint of fatigue. More women commonly experience this than men. And as a note of an impact on fatigue on our daily life and on things like the economy of the country in general, the last time this was measured for lost productive work time or cost to employers because of fatigue was estimated to be about $136 billion alone. What is acute fatigue caused by? It can typically be due to a recent medical complaint. Sometimes when people are experiencing things like a flu infection, they may be experiencing a sensation of a lack of energy that we would call fatigue that is associated with this infection, although not necessarily the most significant or most severe symptom can be one of the most significant ones that people experience. It can also be like due to things like COVID infections, which is obviously something that is on everybody's mind since 2020. Life stresses by themselves, which without a specific medical cause behind them, can also contribute to acute fatigue. Just a note on COVID and fatigue. Fatigue is one of the primary symptoms associated with what we're calling long COVID, or long-term symptoms associated with an initial COVID infection once the first most severe symptoms have passed. Factors in long COVID that influence who may experience fatigue include older age, or those over 65 years, female sex, severe infection in the acute phase of the infection. So when you have a severe infection in the first blush of symptoms, multiple significant pre-existing medical conditions, or a previous diagnosis of depression and or anxiety. At this point, though, the data is still being teased out, and more studies are needed to really tease out this connection to see how one thing may influence the other. Chronic fatigue can be caused by many factors, as you will see. Issues with the heart or lungs, with the thyroid, kidney, or liver, levels of salts or electrolytes in the blood, including your sodium or potassium, anemia or other blood disorders, viral infections, including HIV, mononucleosis or hepatitis, rheumatologic conditions like rheumatoid arthritis, psychological conditions like depression or anxiety, neurological conditions like Parkinson's, effects from medication, alcohol or substance use, even things like anxiety and depression, as we mentioned, or grief from loss of friends or family, stress from personal or financial problems, feelings of a loss of control in your own life, and then obviously not getting enough sleep, which we will discuss later. Certain foods and beverages can also affect your energy levels and contribute to fatigue. These include things like energy producing things that we eat like caffeine, or excuse me, that we drink like caffeine, but also things that we eat more for pleasure like junk food or alcohol. Also, too little or too much exercise can contribute to fatigue as well. Alcohol by itself is worth discussing and how it influences fatigue. And in addition to affecting balance and coordination, as well as having an impact on your mood, alcohol use can sometimes increase your levels of fatigue beyond what you've already experienced or introduce them into your day-to-day life. Men, as a note, should have no more than 2 drinks a day, and women should have no more than 1 drink. And a drink, as defined by the FDA, is defined as 1 regular can or bottle of beer, 1 glass of red or white wine, or 1 shot of approximately 80 proof liquor. So it's really not that much. Ways that you can treat fatigue, including keeping a fatigue diary to look for things that may cause you to feel fatigued and to get a better sense of what may be influencing your energy levels throughout the day. Exercising regularly, but moderately. Trying to avoid long naps, especially in the evenings or before bedtime. If you stop smoking, which is just a good idea in general. And then asking for help if you feel swamped with things in your life that may feel like they're contributing to you feeling like you're out of control. When seeing a doctor for fatigue is something that there's no particular trigger for it, but if you're feeling fatigued for several weeks in a row, it's a good idea to see your primary care physician, as well as if there are other symptoms or worsening symptoms associated with fatigue, or if there's no clear trigger for fatigue that's been going on for a long time, or if it is particularly severe. We discussed chronic fatigue syndrome, which is an explicit medical diagnosis previously, and I just wanted to touch on that for a few slides here. Chronic fatigue syndrome, or CFS, is also known as myalgic encephalomyelitis, and it's fatigue that lasts for 6 months or longer and is not related to any other diseases or conditions. At that point, when you are diagnosed with chronic fatigue syndrome, your symptoms of fatigue are severe enough to interfere with your daily tasks of living, which include things like dressing or bathing or going out to get groceries, or really just anything that you would do on a day-to-day basis that you no longer can because of severe fatigue. Other symptoms may include problems with sleep, memory, or concentrating, or there might actually be physical symptoms that are expressed, including dizziness, sore throat, or tender lymph nodes. There are at this point no cures or approved treatments for CSF or CFS, but ways exist to treat or manage some of your symptoms. Your doctor will evaluate you for fatigue by first taking a thorough history of your fatigue. They may include questions about your mood, the symptoms you are experiencing, how you're sleeping, what medications you use, or even your diet or alcohol consumption. They will want to perform a physical exam. You should expect them to evaluate parts of the body that may not seem related to your fatigue directly, but are nevertheless influence your metabolism, which contributes to your energy levels, including things like your throat and your thyroid gland, your belly, obviously your heart and your lungs. They may look at your skin or just whatever they're concerned about that may be causing your fatigue to become particularly bad. They may or may not order lab work or other imaging. It will really be guided based on what they're seeing on the initial questions and answers you provide them, as well as on the physical exam. Your doctor will want to treat you for fatigue by first addressing your underlying medical conditions. They may advocate for changes in diet or exercise based on the suspected cause. And because many things influence fatigue by itself, they may try medications or therapies that are associated with other conditions that are not previously known. Things like cognitive behavioral therapy, a form of psychotherapy for hidden depression, along with starting an antidepressant. Now, pivoting a little bit to sleep, fatigue and sleep.
All right, Dan, could I jump in just for one
Please,
second?
please,
This
please,
was
please.
totally my fault, and I apologize, folks. I had told you at the beginning you could use the chat, and then I realized that I had not opened the chat to attendees. So my apologies. I just changed that. You all do have access to the chat now, so feel free to submit questions and comments along the way.
Are there any questions right now that people want to get answered? I'm happy to just take a quick break.
Yeah, that's great. Let's just take a minute if anyone did have questions they were trying to get in. One and that I just had when you were going through this, which you might get to in this next section, which actually you probably will see in the slide. You mentioned that fatigue is different than sleepiness. And I was wondering if you could just expand on that a little bit.
Sure. I think it's a good way of looking at it is just kind of like a common sense definition. So sleepiness is like an actual desire for sleep. You want to go in, you want to rest. I think fatigue may be a little bit more subtle, and it's really a sensation of just a lack of energy, if nothing else. You don't necessarily need to go and get rest right now, but you just don't have that energy that you need to get through the day and do the things that you normally would for yourself. Does that make sense?
It does. It does. Thanks. All right. Well, seeing no other questions right now, continue on with the slides, and I'll keep an eye on the chat.
Great. Thank you. So fatigue and sleep are somewhat related. As we just discussed, one is not necessarily the other, but they kind of lie along a spectrum of what we call symptoms or disease, and they certainly do influence each other. And scientific literature has shown that better sleep is tied to less fatigue, particularly in older patients over 65 years old. And as we probably all know, a good night's rest helps diminish fatigue throughout the day. The medical definition of sleep is actually pretty interesting in my mind. It's a rapidly reversible state of what we call reduced responsiveness, motor activity, and metabolism, or more simply, a time when we are less active, not moving, and things in our body tend to slow down. All animals, including ourselves, sleep, but why they do it, and by extension, why people do it, is not ultimately understood. Sleep, that we do know, sleep has many effects on things like energy conservation, restoration and consolidating memories, as well as influencing basic body processes. And it's worth noting that humans spend about a third of their life, or 8 hours a day, asleep. There are 3 stages to sleep. Each one kind of blends into the other. And throughout the night, we may experience different ones as we are interacting with stimuli things we might hear or things we might see, like a light that's been turned on. And we kind of trend from one to the other as we progress through the stages of sleep. So the first one is obviously wakefulness. The second one, which is itself comprised of 3 smaller stages that I'm not really going to go into today, is called non-rapid eye movement sleep. And the third or last and probably and deepest stage of sleep is known as rapid eye movement or REM sleep. As we discussed, non-REM sleep is broken down into 3 stages, which each represents a subsequently deeper part of sleep, and it finally culminates in REM sleep. And what we do understand through years of study at this point is that during various stages of non-REM sleep, your body works on things like consolidating memories throughout the day, repairing and regrowing tissue, building bones and muscle, and strengthening the immune system. So sleep is very essential for not just processes involving the brain, but processes involving the entire body itself. Rapid eye movement sleep is the stage of sleep most associated with dreaming. And through my studies and getting prepared for this lecture, the thing that I found to be the most interesting and most salient trait of REM sleep is that it's really important for retaining not just important memories, but we make connections in our brain all throughout the day with things that we may not consider to be very important. And there may actually be a function in the brain to prune or remove these to save space for later, more important memories that will be formed in the future. Older adults typically need between 7 and 9 hours of sleep a night. Many older adults do tend to go to sleep earlier and get up earlier than they did when they were younger, and many factors can influence their ability to fall and stay asleep. Unfortunately, it is a common fact for older adults above 65 years old that they may have difficulty initiating and maintaining sleep. In fact, approximately 43% of older adults in the United States do have problems with this. And while the ability to sleep becomes more difficult in these people, the need for it does not always decrease, contributing to things like fatigue. Difficulties in sleeping may be due to disruptions in the region of the brain called the suprachiasmatic nucleus, which is responsible for regulating what we know and what we call your circadian rhythm, or essentially the rhythm that dictates how you move and behave and your energy levels more than anything else throughout a 24-hour cycle in the day. Things that affect sleep include poor sleep habits, irregular sleep schedule, trying to force sleep, drinking caffeine or alcohol near bedtime, especially in the late afternoon or evening, and things like smoking or other nicotine intake during the evening. Other things that might affect your sleep include things that stimulate the sleep environment. Again, what we call psychosocial factors in medicine, persistent concern or worry about day-to-day events, lack of exercise, frequent long daytime naps. These are typically greater than 30 minutes, so they're late in the day, certain medications, and pre-existing medical conditions. Insomnia is defined as the inability to fall asleep when you want, and also to stay asleep throughout the period of rest. It is, like fatigue, one of the most common symptoms for which people seek medical care. And although older adults do experience this a little bit less frequently than younger adults, sleep initiation and getting restorative sleep does become more prominent with age. Insomnia by itself, though, is the most common sleep problem in adults 60 years old or older, and it can last for days, months, or even years. It, like fatigue, can be defined in a number of ways, including taking a long time to fall asleep, waking up many times in the night, waking up early, and being unable to get back to sleep, waking up tired, or feeling very sleepy throughout the day. Insomnia is treated primarily with cognitive behavioral therapy, again, a form of psychotherapy that's targeted at insomnia itself. It takes multiple steps. They evaluate what's called your sleep hygiene or sleep habits initially, and then they will see how they need to tailor management moving forward. And I think what's most important is that it's non-pharmacologic. They don't want to incorporate medications in it initially because there may be side effects and it's not the most effective therapy out there. Other ways of treating insomnia include exercise and things like Tai Chi. Other conditions that may affect your body's ability to get to sleep include sleep apnea, which is a condition where people have short pauses in breathing while they sleep, which may occur many times throughout the night. And if not treated, may cause issues with not just sleep, but high blood pressure, potentially causing factors to lead to things like a stroke or even influencing loss of memory. Movement disorders may also affect sleep. These include things like restless leg syndrome, periodic limb movement disorder, and something called rapid eye movement sleep behavior disorder, which can all affect your sleep, either individually or together. Restless leg syndrome is characterized by feelings of tingling, crawling, or pins and needles in one or both legs. Periodic limb movement disorder causes people to jerk or kick their legs every 20 to 40 seconds during sleep. And then during REM sleep, you're typically not able to move your muscles, but if you have REM sleep behavior disorder, you can. It can be disruptive to both you and to your partners as you are getting sleep and moving around. Alzheimer's disease can also affect people's sleep patterns. People who have Alzheimer's disease may sleep too much or not enough. They may wake up, wander, or yell throughout the night as well. And if you are caring for someone with Alzheimer's disease, take steps to make sure they are safer at night and you can both sleep better. And I'll outline some of those steps in a couple of slides. So, ways to get better sleep, which is something we're all concerned about, obviously. Try to follow a regular sleep schedule. Go to bed at the same time every night. Try to see if you can orient your schedule throughout the day to really help contribute to this. Try to avoid napping in the late afternoon or evening. See if you can develop a bedtime routine so that you're doing the same thing every night as you prepare to go to bed and your body starts to settle down and get ready for rest. Try not to watch television, use your cell phone or tablet, or log onto the computer before bed, because that kind of stimulation can really affect your body's ability to get rest. Keep your bedroom at a comfortable temperature and keep it as quiet as possible. Use low lighting in the evenings and as you prepare for bed. Exercise at regular times throughout the day, but not approximately 3 hours before bed, because this can have a stimulating effect on you. And then try to avoid eating large meals before bedtime, as this can also have a stimulating effect. Try to obviously stay away from caffeine late in the day, and then avoid alcohol when trying to sleep. And then I want to discuss some safer ways to get to sleep. And I think that this is not just practical advice for your sleep habits throughout the night, but is a good general advice really for creating a safer environment for yourself at home. So try and set up a safe and restful place to sleep for yourself. Make sure you have smoke alarms on each floor of your house. Before going to bed, lock all the windows and doors. Keep a telephone with emergency numbers by your bed. Have a lamp within easy reach that can be turned on easily. Don't smoke, I think in general, but especially while you're in bed. And then if you have to get up in the middle of the night and go to something like the bathroom, it's a good idea to remove rugs around your bed so you won't trip if you have to get up and potentially cause an injury. I think, the best time to see us or someone like me in a primary care clinic, if you have issues with sleeping, is if you have persistent problems with sleeping for greater than 2 to 3 weeks. If you are told you snore at night and you or someone you know suspect you have sleep apnea, or if you suspect you have any of those movement disorders that we described. And finally, I guess I finished a little bit early. One book that I've been reading recently, I have no relationship to the author. I have no relationship to the publisher. I just thought this was a really interesting discussion about dreaming. Dr. Ribeiro is a neurobiologist in Brazil who studies the science of sleep and dreams. And he wrote this book that's really discussing the history and cultural effects on dreaming throughout the world, as well as the science behind it. It's not too dense, and I think it's a really interesting deep dive into what we do when we're asleep. And these are my sources, and I will stop sharing my slides.
Awesome. Thank you, Dan. And we did have a couple of questions that came in as you were speaking that I'll start to read off for you, and also encourage other folks to get your questions in. So the first one about napping. And the question being, when you say 7 to 9 hours is recommended each night, is that in a uninterrupted period? Or so this individual shared that they sleep 6 hours at night and then take an hour nap during the day. Does that meet the sort of 7 to 9 hours in a 24-hour period? Or do you really want that uninterrupted sleep as much as possible?
I think it would be good to try to get that uninterrupted sleep if possible. But if you're able to take a nap throughout the day and it doesn't affect the rest of your sleep at night and you're feeling rested and not fatigued, I mean, if that works for you, that works for you.
Yeah. I've kind of heard that advice before too. Like if you have something that's working and you feel like you're getting the rest that you need, that it's okay. But I mean, you said napping, kind of avoid that late in the day or in the evening. Anything else that you'd say sort of on best practices around how and when to nap?
Yeah, so the literature that I consulted said basically naps above 30 minutes are considered to be longer naps. So if you're going to take that, try to avoid them in the later afternoons or evenings because that may affect your sleep cycle during that circadian rhythm that we talked about. You want to really be able to say nighttime is the time when I'm going to get as much uninterrupted sleep as possible. And if you're starting to have sleep during the times we just talked about that's getting closer to it, it's going to affect your body's ability to really like lie down and stay asleep throughout the evening.
Another question that came in, urinating. So ways to cut down on, I guess, kind of waking up frequently because one has to urinate at night.
So that's a good question. It's one that there may be a couple of factors that are contributing towards it. Sometimes people have issues with things like a prostate that is getting enlarged just because of age, and it can affect your body's ability to get urine out in an appropriate time and fashion. I would say, if nothing else, try to cut down on water intake before bed. And then if you're having problems with frequent urination or inability or desire to urinate and you're not able to do so, I would really consult a urologist. They're experts in managing this, and they're able to really comprehensively evaluate you and then hopefully get you things like, I don't know about medications necessarily, but it is something they could try, or other therapies that would cut down on your desire to go to the bathroom or need to go to the bathroom, and also help you stay asleep at night.
What is your take on sleeping pills? And I think this is especially talking about sort of over the counter, Unisom or some of these different ones that people might try.
I think so. Over the counter, just generally speaking, sometimes you have to be careful with the over-the-counter medications because they may promise something but are not able to do it. So just always read the label and make sure that it's been FDA approved for what it's saying. That being said, Unisom or Melatonin are the ones that I most commonly hear people discussing when they're talking about an over-the-counter supplement. Of those two, Unisom can be sometimes a little bit sedating. So if you're going to take it, I would suggest trying to take a half dose of whatever is prescribed. I think it's usually about 25 milligrams. I'd probably start with like a 12 milligram half dose if you want to take it. But even before that, I try melatonin. It's very well tolerated. It is easy to find it in smaller dosages, which I always think is a good idea to start with any medication that you're getting over the counter. You can get it at like a 5 milligram dose. Try it once and see how it helps your sleep. And if that doesn't work, you can talk to your doctor about seeing if you want to go up on any doses for it. But it's a really safe medication, and I would say of those two, it's probably the better one to try.
The melatonin.
Yeah, melatonin.
Yeah. Thank you all for the questions. Keep them coming.
Yeah, these are great.
So if I wake up in the middle of the night, is it better to get up and do something, or to stay in bed and try to fall back asleep?
So that's a question regarding sleep hygiene. And I would say probably the common sense answer is just try to stay in bed, try to go back to sleep. Because if you're getting up and doing things like turning on lights and you're stimulating your brain to think that you are awake now, it's going to be more difficult to try to fall back asleep. The issue obviously is if this is going on for a long period of time, then you may be starting to experience something like insomnia. I would say if that's happening for a week or two in a row, then it's a good idea try to consult your primary care physician and see if they have any ways that they can help positively affect that, so that you're not having any problems with that.
This might go a little bit kind of beyond what you would see in your work, but could you talk at all about sleep studies and sort of what happens in a sleep study, if that was recommended for someone who is having any of these persistent issues?
Sure. I mean, it's going to be very general just because I'm not really an expert in sleep studies, but essentially what they're going to do is going to measure different, what are called physiologic factors, to see how they're influencing your ability to fall and stay asleep. It may be that they're measuring your brain waves, for lack of a better term, on something called an EEG. They're measuring your respirations to see if you do have something like sleep apnea. It would be conducted with a appropriate expert in sleep medicine, who's sometimes also a pulmonologist or a lung doctor, because a lot of those things influence each other. Beyond that, I can't really say. It's a great question, and it's something that I would definitely, if you have interest in that, or you are scheduled for a sleep study, I would touch base with your primary care physician or the sleep physician who assigned it to you, just because they'll be able to better answer it for you.
And I imagine that's sort of a like case by case too, of like what they're really looking for depending on the problems. Awesome. That's everything that has come in so far, but folks, continue to get your questions in. I'll ask one selfishly, as someone who shares a bed with someone with restless leg syndrome. How do I get him to stop? Is basically the question. So what are some of the treatments for restless leg, or some of these other, like, I think you categorized a couple as movement disorders at night?
Restless leg syndrome in particular can sometimes be caused by things like iron deficiency anemia. So it's not the cause for everybody, but it's something that it's a good idea to get medically evaluated for, in case that's the issue. If it is like iron deficiency anemia, you can get supplementation for it that would hopefully fix the problem later on down the road. But again, I mean, I hate to sound like a broken record, but a lot of these things are case by case basis. And you just need to figure out what the specific cause is that's contributing to it, and then try to address that. I would say in the short term, though, if you can find another place to sleep so that you're getting a good night's rest, then maybe try that until they're able to get fully evaluated.
Thank you. I will tell him you said that.
Doctor's orders.
Yeah. Awesome. Any other questions that folks have? Feel free to get those in the chat or in the Q&A. But I think that is everything that has come through so far. So I guess I would sort of leave it to you, Dan. Is there anything else that you want to be sure folks? Oh, great. Oh, this was just a comment that to get a king bed for the restless leg.
Yes, it's a good idea.
You. But yeah, so Dan, any other sort of final tips that you would leave folks with before we close out?
I think what was interesting to me to see as I was researching this lecture is that there's a lot of things that are influenced by mental and emotional health, like both how you sleep, how long you're able to sleep, if you're not able to sleep. And it's something that we like to focus on the body a lot of the time, but the body and the mind are interconnected. And I think it's a good idea that if you feel like you need to talk to someone about that, like, make sure all those different domains are being addressed if you're able to do so, and it's not necessarily just, I just think that was really relevant to me. And I think sleep is so important for your hygiene and for your ability to get through the day, and just really focusing on it is super important.
Yeah, that was interesting to me when you were talking about cognitive behavioral therapy. We've talked about that in Doctors In before, when we've done things on depression and mental health, but really seeing that as something that's recommended for sleep as well.
Yeah, and I think especially when you're starting to talk about older adults who might have a bunch of medical conditions, sometimes your doctor is not necessarily loath to start new medications, but they'll be considerate of other ways to get your problems treated, because medications can affect you in ways that never want to do, but don't always anticipate. They can interact with each other, and it's better if you can just defer that entirely. Like, go ahead and do it, you know? And so if you're going to do CBT, like, I think that's a great idea.
That's great.
Yeah.
Wonderful. Well, thank you so much, Dr. Boron Brenner, for spending some time with us here, for answering all these questions, sharing this information, and to folks in the audience. I hope this was helpful in, providing both some of the medical background, but also some of the practical tips for getting better sleep and dealing with fatigue.
I'm going to go ahead and put my email in the chat in case anybody has any further questions, and they can always
be wonderful.
Out.
Awesome. Thank you so much for that. And with that, we can draw things to a close, but thank you again, everyone, for joining us here this afternoon. Thanks to you, Dan. I hope we'll see you again this year for Doctors In as you complete your fellowship at Jefferson. Hope everyone stays healthy, stays well, gets a good night's sleep, and we will see you all soon.